Today we're going to look at the scapula, and we're going to carry on and we're going to discuss rotator cuff muscles. So there are 4 rotator cuff muscles, and they are supraspinatus, infraspinatus, teres minor and subscapularis. And they stabilize the glenoid humeral joint, which sits here, so the shoulder joint. All the rotator cuff muscles are accessible, including their tendons. And they all attach to the head of the humerus. So they all attach onto here. So we have the supraspinatus, which is located in the supraspinatus fossa, which is deep to the trap fibers. So if you remember, it sits in here. So here is the spina scapula here, and the supraspinatus fossa is in here. So this is where the first rotator cuff muscle will sit. Its belly runs underneath the acromion, so it goes here underneath the acromion. So if you remember, this is the flat bone here. And what it then does is then attaches to the humerus greater tubercle. So the supraspinatus assists with the deltoid with abduction, so ABD, of the shoulder. And it's the only muscle of the rotator cuff group that is not involved in shoulder rotation. So then we have the infraspinatus. So remember, this sits on the posterior side. So we've got our infraspinatus fossa, which sits right here. Its belly is superficial with the medial portion deep to the trapezius and the lateral portion beneath the deltoid. The infraspinatus attaches immediately posterior to the supraspinatus on the greater tubercle. So again, it comes across and attaches to the greater tubercle and the humerus. And it works together with the teres minor. So infraspinatus and the teres minor will laterally rotate the shoulder. Then we have our teres minor muscle. So if you remember, the teres minor will sit on the lateral border of the scapula. And it's squeezed between the infraspinatus and the teres major. So if you remember, the teres major will insert right down here. It's located high up here. It can be challenging to kind of palpate it. And the teres minor and the teres major, which is not a rotator cuff muscle, but they work together and they're agonists in rotation of the humerus. Then we have the deep subscapularis. So if you remember, if we turn the scapula around, we have the subscapular fossa right here on the anterior surface of the scapula. And it's sandwiched kind of between the fossa and the saltatus anterior muscle. And then again, this attaches to the humerus lesser tubercle. So it's the only rotator cuff muscle that does that. And it rotates the shoulder medially. So supraspinatus, infraspinatus, and teres minor, they all insert into the greater tubercle of the humerus. And subscapularis is the only one that will insert into the lesser tubercle of the humerus. Supraspinatus will abduct the shoulder, so ABD, the shoulder, and it will stabilize the head of the humerus and the glenoid cavity. Infraspinatus laterally rotates the shoulder. It adducts the shoulder, so ADD, the shoulder, and it stabilizes the head of the humerus and the glenoid cavity. And then the teres minor does exactly the same. So I always think the 2 rotator cuff muscles in the middle do the same thing. So it laterally rotates, it adducts the shoulder, and it stabilizes the head. And then subscapularis is the only one that medially rotates the shoulder. Then if you remember, supraspinatus is the only rotator cuff muscle that is not involved in rotation. Hopefully that's expanded your knowledge a little bit on the rotator cuff muscles. Thank you for watching, and please subscribe.